All right, early morning sharing personal experience because this is applicable to more than just myself. And I was going to make a video about when does your pain dictate going to get care versus when does your pain dictate rest and ice. So I'll just give you a real world example. So I woke up feeling great, back's doing fine. This is not a backstory. I was just doing some calisthenics and I started squatting and my right knee didn't click, didn't pop. It just started hurting, like throbbing, but like really deep pain. And I've had this from time to time, whether it be knee or ankle or foot or heel. And what this is really, and believe it or not, get ready for this one, it is tendonitis. And I know this because what's happening is it feels very muscular in nature at the bottom of the quad within the knee joint, but also radiates down further. And it's not a lumbar problem, although it could be originated from the lumbar. However, this is where a fascial distortion or a tendonitis and that combination of multiple muscle and fascia type things needs to be addressed. So how will I address this? Well, I could do a couple of things. One is, and you could out there too, if you have a similar kind of situation, you get comfortable on a chair, you find your Tiger Balm or some kind of like a arthritis cream, and really you just get in there with your thumbs or your hands and you just kind of do it to on the tender spot where it starts to feel good. I like doing like a cross friction type pattern as opposed to rubbing down or rubbing up. Although if I had to be extra specific, I would be rubbing across and up. I wouldn't necessarily go down, sort of like within the reason that the upper part of the fascia is probably pulled down and tight from being in a seated position or being in a squatted position. So you actually want to release it up and out away from where it's tight and binding, because I feel it on the inside of the leg, on the inside of the knee. And that would be step one. Step two in a perfect world is you would go and get passive ART style, which is a pin and stretch kind of therapy, or even someone at my office would do shockwave on that site, which would be probably the fastest way out of it over literally 3 minutes to reduce all the adhesions and the scar tissue formation that are within all the inflammatory cytokine components causing that kind of pain in the knee. Because when you get that kind of pain, of course it's a warning sign. Of course it's your body being told, hey, take it easy. Like there's a lot of scar tissue, there's a lot of swelling. Again, especially early in the morning when we're groggy and just start moving around. There's a reason why our tissues are stiff and arthritic, even though it's a different thing. And yeah, so that just happened to my right knee, and hot shower made it feel a little bit better, but I am going to follow my own advice today and probably head to the office and do some shockwave. I may wait till tomorrow morning though, got some errands to run. But that's the the morning news. That's what's going on. I mean, when you get these just sort of annoying pain, but with no mechanism of action, like, I mean, yeah, I squatted, but it didn't pop, it didn't click, I didn't fall down to my, to my knees, like, crying because I felt a tear and I can't move it. It's really more of that squatting and beginning to go into a squat and putting weight on it really is bothersome. And this is where a lot of the soft tissue techniques, a lot of the, how should I say, progressive motion, even if it's active, seems to be okay, and how you can best help yourself in a situation like that. All right, guys.